This video is being made as a training aid for the new needle airway Cric policy that will be coming out for CCT. First, we'd like to show the equipment that will be in the bag. It starts with 2 alcohol preps. The next will be a 3 ml syringe with needle combination that we currently have in our airway drawer. Next will be a 14 gauge catheter. You want to get a large bore catheter as you possibly can. And lastly, you'll see a 7.5 ET tube. What we're going to be using is the 15 millimeter adapter on the top of the ET tube. Pediatric bag valve will be something that will be very helpful in this because it's a lot easier when you're doing a technique like this to be able to use a bag valve that's small and easy to handle. Before we begin the procedure, we'd like to go over a little bit of the anatomy. First, we'd like to show you where you're going to go to insert the needle. As you can see, you got the thyroid cartilage, and then underneath you got the cricoid cartilage, and between it you have the cricothyroid membrane. That soft spot right there is where you're going to be inserting the needle to be able to go ahead and do the procedure. Okay, to begin the procedure, we're going to go ahead and we're going to prep the area which we're going to cannulate. Next, you're going to take out your 14 gauge catheter. Put it at approximately a 45-degree angle. Insert the catheter downward till you feel it pop into the airway. Then go ahead and advance your catheter off of your needle. At this time, you're going to go ahead and take your 3 ml syringe. Pull the plunger out, attach it to your catheter, and then the final step is to go ahead and take the end off your 7.5 ET tube, place it into the 3 ml syringe, try to get a good seal if you can, and go ahead and use the pediatric bag valve mask to bag through the device. The final step in our procedure is going to be to show you how to secure it. This is one of the easy ways that we've learned to secure it in the past. We're going to go ahead and we're going to take a long piece of tape, go and place it right over the catheter, right where the hub of the syringe hooks onto the catheter. Next piece, we're going to go ahead underneath the go underneath the syringe, and we're going to crisscross. That'll hold the whole assembly in place for you. One thing you don't want to do is secure anything with the syringe to the chin, and that way if you have to manipulate the airway some way or form, or you have to go ahead and intubate later on, you don't want to have them turn the chin or move the chin and have them pull out your needle before, your catheter before it is time to pull it out.